So with hospice, I know that there's also something called palliative care. What is palliative care? How does that work?
That's a great question, Michael. Palliative care is kind of a buzzword. You hear palliative care, the term palliative care used a lot these days in healthcare. Palliative care is really an approach that looks to palliate, which is take care of symptoms, to manage symptoms, and palliative care uses a holistic approach again, similar to hospice in that. But palliative care also is for people who are still pursuing some treatments, who still are looking for some curative actions, as well as managing where their disease currently is. Willamette Valley Hospice has a palliative care program. Through our continuum, we have transitions, and from transitions, which is a non-clinical program to help people understand connect to resources and understand where they're going, to palliative care, which palliative care is for people who are still looking for receiving some sort of treatment, or still looking at still some curative actions but need a little support. So palliative care is perfect for people who don't want to go to the hospital anymore. Palliative care assigns a case manager and keep people from bouncing in and out of the emergency room, which is never a good thing. It helps manage medications and which medications conflict with which ones. So a palliative care team, a nurse and social worker, come in and they work together with the family and the patient, and they look at what the goals are. It's all about setting specific life goals, and look what those goals are and figure out how to meet those goals. And the goals might be to stay in the home and not have to go to a facility. The goal might be to stay out of the hospital and stay out of the emergency room. So through medication, but at the same time the patient is looking at still doing some curative treatments of some sort, or hoping to have something else happen, still taking dialysis. So palliative care comes in and supports them where they are and keeps people from having to do those things that really drive them further into a negative spiral. What we see often is that people go into the hospital at this level, and they go to the emergency room, and when they come out, they're here. And if they go in, they're going along fine. They go to the emergency room, they come out, and they're here. So it's a stair-step thing. And what we do through palliative care is try to avoid that and break that spiral altogether.
Okay, so it sounds like then maybe the person or the people that are really eligible for palliative care or need palliative care, those who are going into the hospital, coming in and out of the hospital, maybe have some issues that really need some kind of attention to try and help lift them up to keep them from going back into the hospital. Is that right?
Yeah, absolutely. They have a life-limiting diagnosis of something. There's some sort of life-limiting disease going on, wherever that is in its progression. Hospice is for people who the prognosis is 6 months or less if it takes its normal course. Palliative care is much more open than that. It's just people who have some sort of a diagnosis that's leading them down that path, and it could be at some way earlier point in that diagnosis. So it's how it is defined and who it serves is largely a matter of the particular insurance companies. One of the challenges with palliative care is Medicare does not pay for palliative care.
Okay.
So many of the commercial insurances and Medicaid do have some palliative care benefits, and it depends entirely. Each of them defined a little bit differently. As I said, palliative care is still kind of a loose term in how people use it, and each of the insurers define it a little bit differently. And we have contracts. We're the only people that have home palliative care in the Salem area, and we have contracts with many of the major insurers, commercial insurers, and with most of the Medicaid providers in our community.
So it really sounds to me like we get a lot of people who are interested in staying in their home. They don't want to go to an assisted living. They don't want to go to a nursing home, which is understandable. It sounds like if that's your goal, then this really is kind of a...
This could be a very good fit for people who, if that's their goal and they just need some extra support. I mean, how nice is that to have a nurse that comes into your home to help you manage your medications instead of having to go to the clinic, having to go to your doctor every couple of weeks, and how nice it is to have a medical social worker who comes in and can help with some of the advanced care planning, because really what we want to do is we want to help you reach your goals. So there's a lot of discussion about end-of-life goals. There's a lot of discussion about what's it going to look like, what do you want, what kind of interventions do you want? As things progress, what are the things that you want to have done to you or not have done to you? So we do a lot of palliative and transitions and hospice as well. A lot of what we do is discussion. It's a lot of a lot of having what we call the conversation, and we do a lot of talking about the conversation and helping people discover those goals, write out those goals, do advanced care planning, and then we help them, support them to meet those goals.
Great, thank you.